Jack, a 30-year-old, has been dealing with a rather embarrassing issue. Despite not drinking an excessive amount of water each day, he finds himself needing to urinate every hour. Concerned by this unusual frequency, he visited the hospital for a checkup. The test showed no abnormalities, and the doctor reassured him that it wasn't a serious issue. Water is essential for maintaining the body's balance of fluids, both inside and outside cells. You've probably noticed that some people can drink a lot of water and rarely need to use the restroom, while others feel the urge almost immediately after drinking. How quickly does water turn into urine? Many people wonder how long it takes for the water they drink to become urine. When you drink water, it travels from your mouth to your stomach and then to your small intestine. Once it reaches the small intestine, it gets absorbed into your bloodstream, diluting the blood. In an empty stomach, water can reach the small intestine in about 5 minutes. The blood circulates through the body in roughly 20 seconds, allowing the water to mix with the blood and travel to various organs. The water moves through the vena cava to the heart and then gets pumped through the aorta to the kidneys. In about 10 seconds, the kidneys start filtering the blood, forming initial urine. This filtrate moves through the renal tubules, where further filtration occurs, creating urine. The urine travels from the kidneys to the bladder via the ureters. Once in the bladder, it gets stored until the bladder is full, triggering the urge to urinate. From drinking water to the production of urine, the process can take as little as 6 minutes. What does your urination frequency say about your health? The frequency of urination depends on various factors and doesn't necessarily indicate a kidney problem. Here are some factors to consider. Water intake. The frequency of urination is closely related to how much water you drink. Generally, people urinate every 4 hours. If you don't feel the need to urinate for more than 4 hours, you might not be drinking enough water. Mental state. Stress and anxiety can affect how often you feel the need to urinate. Some people might feel the urge to go immediately after drinking water or when they are nervous. This can be a result of psychological stress or a nervous system issue. If this is the case, psychological treatment or medication might help. Bladder muscle function. On average, people urinate about 8 times a day. If you urinate significantly more often without any changes in your diet or water intake, it could be related to the function of your bladder muscles. Weak bladder muscles can reduce the bladder's capacity to hold urine, leading to more frequent urination. When to be concerned about frequent urination? Frequent urination can sometimes signal more serious health issues, such as urinary tract infections. UTIs, infections in the urinary tract, including the bladder and urethra, can cause frequent urination. Diabetes. Increased urination, along with excessive thirst and hunger, can be a sign of high blood sugar levels. Prostate issues. Conditions like prostate enlargement can lead to urinary retention and frequent urination, often accompanied by infections or inflammation. Conclusion. Water is vital for the body's metabolism and overall health, so don't reduce your water intake out of fear of frequent urination. Monitor your urination patterns and consider if they fall within the normal range. If you find yourself needing to urinate every hour, it might be time to see a doctor to rule out any underlying health issues. Thanks for watching. Feel free to like and subscribe if you find my videos helpful. It will encourage me to keep trying.